for the parade.
Perfect timing, Anime.
Oh yeah, making an end.
So you can like put your stuff down anywhere. There, get comfortable. Anime's from our Aurelia location. Anime, this is everybody else.
Hi everybody.
And then eventually they will introduce themselves to you if you don't know them. But we shall get started. Don't be afraid to grab some food. Yeah, just go nuts. It's very liberal, so you can listen and eat and watch as much as you can. Obviously, you got to tape to, and there's like washrooms around the corner and water around the corner. Okay, so welcome everybody. So this year, I do this often, and this is a good crowd that we have. At first, Sean is my student. He set this all up, so thank you to Sean for this one. He got everything organized. And usually, honestly, we started with just like one person or two, and now it's like a good group here. We're gonna run this a little differently. It's the first time we've done an evening session. It's always been morning session, so there's like always people kind of thing. So we're gonna be very practical here. I'm gonna kind of run a fusion of sport physiotherapy, chiropractic, clinical taping, and athletic therapy all fused together. So don't be afraid to ask questions because I'm trained in like all three. And we're gonna use like a McMaster style of learning, which is pretty much, I don't tell you anything until you ask me a question, which promotes engaging thought. So usually there's like a lecture with PowerPoint slides, and then we go through stuff. I'm gonna go right into like demonstrations, and you will try to absorb and memorize as much of it as possible. And then when you actually start to do it, you will then forget everything and then start asking questions, which honestly, it will work out very well. You'll retain it better, but also we'll get through so many more tape jobs. Yeah? Sounds good? But honestly, if there's any questions, don't be afraid to ask, okay? Our goal today, at the end of the day, Sean's going to get everybody's email so you can get copies of the slides. So don't worry about notes unless you want to. And you'll get like a letter of completion, so you could use for your CVs, your resumes, your portfolios. Okay. There is an agenda with everything and all the slides there and contraindications and cautions and so forth. We will not go through it slide by slide because this is not the right setting for it. So we're definitely going to do the ankle. I want to do a wrist, so wrist and ankle for sure. We might show a thumb tape job, a plantar fasciitis or arch tape job, which also acts as shin splints. We'll show that one. And then 2 K-taping tape jobs, one for the shoulder and maybe one for the knee. Okay. If we have time, I'll show one for the back as well too, for back pain. Okay, so there's going to be like K-taping demonstrations plus athletic therapy practicals. Sounds good? Okay, let's go right into the beast of it and show the ankle right away. Okay, so let's do this here. I need a volunteer. Thanks, Claire. Okay.
Oh, I was gonna raise my hand too.
So shoe off, sock off.
Doesn't matter which one?
Doesn't matter which one.
Or well, which way do you want me facing?
You're gonna be this way. I'll bring this up. Yeah. If those are stretchy, you can pull them up.
Yeah.
If they're not stretchy, you can change.
Cheese gluten free. That is for you. Sorry. You said I could go at any time.
Yeah. I don't care. Oh, sit up.
Oh. Which way? Here?
Yeah. I'm just bringing you up. So. You're going up.
Am I still going up?
You are still going up. Yeah.
Well, I feel like I'm going up.
I know. So they're quiet. So in the clinic, definitely use your table. Pragmatically on the pitch or field, you won't have a table that goes up and down. So it's more so like squats, and use your body mechanics or a chair. Okay. Okay. Scooch all the way back a little bit. So just like kind of like that. Okay. For now. Have you ever been taped before?
Yeah.
Perfect. Do you have any allergies to tape?
No.
Okay. Do you play a sport?
Yeah.
What's your sport? Hockey. Okay. No allergies to sports. Do you have an injury?
No.
Yeah. no allergies to tape. You play a sport. And do you have an injury? The answer is no. Okay. So then we wouldn't have to tape you. But we're going to pretend here.
Okay.
So the 3 reasons why I'm going to or why I would tape you is 1, if you have an injury, okay? But it's not an acute injury. Like it just didn't happen. So we and the swelling's kind of minimized. So we're going to we're going to tape for that reason. Another one, it's controversial, is prophylactic or for like prehab. You could just be like loose in the ankle, or you've had a much longer past injury in your ankle and you just don't trust the stability of your ankle, so we can tape for that reason. Or you're you have an injury not too long ago, there's no swelling anymore, but you are in the return to play process. You are ready to go back to play, but you really you need some support to go back, okay? So kind of 3 reasons. We will assume that we're doing this prophylactically, okay? You just don't trust your ankle. So I will look at the ankle, just looking for cuts, bruises, scrapes. Good. I will press your nail bed to look for a cap refill. It goes white and then comes back to red. Good, which shows good circulation. If I don't trust this, I'll check both sides bilaterally to see if they're the same. I'll just get you to go through active range of motion, so it's just kind of go just circular, or circumduction. Good, go the other way. Just looking for pain and range of motion. Looks good. Of course, it looks good. You don't have an injury. I'm going to go passively, just kind of dorsiflexion, plantar flexion, kind of inversion, eversion, and obviously that feels good. And then we are going to get you to do, usually if you have an injury or you had an injury, and if we're not doing this prophylactically, I get you to do something called a figure 8. So you just kind of run around in a figure 8 pattern just to see like what your ankle without tape can take, okay? And obviously how tentative you are and so forth, okay? We're gonna assume that we did that.
Okay.
Okay, so let's tape this. We are gonna tape you for an inversion ankle sprain, which is the most common. So it's basically to prevent you from going that way, okay? If we can tape you going that way as well too, that's an eversion ankle sprain, but the most common is inversion. So what I need you to do is go into, keep this neutral. And what neutral is, it's not completely dorsiflexed, even though you are tight there. You are very, very tight there. Your plantar, it's not plantar flex, it's somewhere in the middle. So with you, keep it right there. And you can't move it, okay? So as the athlete, so you gotta help me out too, so because this is your benefit, so I wanna tape you well, you gotta keep it right there, okay? And if it does go down, some people forget, the therapist is allowed to flick, okay? Just reminds you to go back up, okay? So. So our supplies. This stuff over here. So we will use our Tough Skin or a Paris spray. Shake and spray. I'm not actually doing it. I'm just being fake with it. But you'd spray everywhere here. Spray. And then we would dry it. So we'd go like that. You could blow on it if you want to, but just dry it up. You take your heel and lace pads. I forgot to get the lubricant. You take your heel and lace pads. Take a little bit of Kramer's lubricating ointment skin lube.
Is the GoPro on?
It is on. Put a little bit on. This one's tight. Smear it there. Do you know why we put the Tough Skin on you?
No.
So athletes sweat a lot and the tape would just come right off. So you have to make it, you have to use that. People used to say in classes, like in courses, that it's optional. In real life, it's not optional. You have to use it. It won't work. Put that there. And put that there. We put the heel and lace pads on areas of high friction. which your tendons kind of pop out a little bit. So like dorsal surface and like posterior surface over here. So Achilles area and like tibialis anterior kind of tendon. Hold that on for me. And then I just use a little bit of Pro Wrap to just keep it on here. Now, if you have that sticky stuff, you can let it go. If you have that sticky stuff, it'll just stick right on. So then you wouldn't have to use this. Okay? There's no real rules to Pro Wrap. Kind of just place it on. It's just to help protect the skin from any sensitivities with the tape, or if they have a lot of hair, or if just for sheer comfort, like it's just people just like it better. Okay, athletic therapists do not like putting Pro Wrap at all because they say that tape will stay longer when it's right to the skin. Okay, but also remember that tape sticks better to tape, so keep that philosophy in mind. I just put this one little tape there just to keep the Pro Wrap. Okay, so now you're all prepped, ready to be taped. This is how we're gonna tape your ankle. You keep it straight, good. So I find the belly of your calf, your gastroc, I find where it ends, so yours ends like kind of right over there, so that's where I start my tape job, like that over there, and I work all the way down. I put the first piece of tape in like a triangle, like roof-like formation, and the first piece of tape is called your anchor, okay? That's just the name of it. So I'm gonna put 2 anchors down, a half width apart from each other, so they overlap by a half width apart. I'll put another anchor at the bottom part. So the bottom part is, you find your base of your 5th metatarsal, which is like right there, and it's just like distal to that. So there, and it goes on the foot. Okay, so there and there. So my anchors are on. I'm gonna do my first strip. So it's a horseshoe. It's called a horseshoe. So you go from medial to lateral. So medial strip, just to lateral, back to the other anchor, smooth it as you put it on, and then that's your horseshoe, and then you put a stirrup. A stirrup, let's just go from the bottom. A stirrup goes from like medial to lateral, or lateral to medial, I don't care. And then you do another horseshoe. So you do another horseshoe, kind of exactly medial, but I just angulate it a little bit. And then it still goes through the bottom of the calcaneus. Smoothing it the whole time. And then we put another stirrup. But just overlapped now, okay? And then we put the third one, the third horseshoe. Now I'm a little more posterior. Good. And then another stirrup. Okay, and this pattern of going like horseshoe stirrup is called a closed basket weave. We're just like basket weaving. It's just that pattern. I'll then do a bunch of stirrups just to close it off. If there are any windows, do you know what a window is, Claire?
Is it like the light part?
Yeah, it was any little like opening within tape that you see your skin. So basically you can't show any openings. The reason for that is because the edges of that opening, the edges of the tape, will dig into the skin and cause like cuts and blisters. So you want to close all windows. Okay, everything looks good here. Now this takes care of 20% of your stability. The next 80% of the stability is now what we're going to do, this next part, which is called your figure eights and your heel locks. Okay, so figure 8. You start on the medial side, you go around the foot and then around the ankle. And it has that 8 pattern to it. Okay. And then I can do another one. But I'll start on the, annoying. I'll start on the other side. So, wham. So if that's bad, I'll fix it up. There. Okay, so 2 figure 8s and now 2 heel locks. The heel locks will go, you can go either way. We'll start laterally and then I'll go medially. So you start at the malleolus. Okay, this is your lateral malleolus. You go straight down to the floor, around the calcaneus, back up to the same malleolus that you started at. And I'll do another one on this side. So, medial malleolus, straight down to the floor, around the calcaneus, back up, kind of to where you started. Okay, all done. We just put a little strip right there, and we put 1 or 2 more anchors at the top. Right. I'll just put 1, and then we just kind of smooth it over. A little wrinkle there, but overall pretty functional. And then we're going to do a check. Good job for not moving. I'll check your cap refill. Good. So it goes white. Cap refill. Cap refill. So
That's like a circulation test.
circulation test. Otherwise, it's too tight, right? And sometimes you can see discoloration. That means the therapist went a little too tight, but medically, if you have cap refill, then you're fine, okay? We'll do your passive stress test. So I'll go into inversion. The minute I feel the first resistance, it's called R1, I stop. So I stop up to there, right? And then I'll do the same thing here. Nice and relax. R1 is there. R1 is there, clearly different, okay? And then I want you to do a figure 8, okay? So come down. And you just go to that side.
Like, what do you mean?
I'll show you. I'll do it, come. So. Figure 8.
Oh, like, okay.
Yeah.
So,
Yeah.
this side, you have to go under, or does it matter?
Yeah. Good.
Looking at the anchor.
And you usually do about 2. And then you just tell me how it feels. Does it feel?
Feels good.
Feels good. Perfect. Okay, guys?
Yeah.
That is a full ankle. It's a lot of tape. It's a lot of tape. So partner up, okay, or triple up. I don't care how you do this. And take some supplies. You're going to fake your spray. You're going to even, you use the heel and lace pads if you want. You can use the Pro-Up if you want. Just ask me questions. Danielle and I will be going around answering as many questions as possible. Okay? Go ahead and take whatever bed you want. Okay? Sweet.